My name is Debra Lopez Gottesman. I'm a licensed psychiatrist and have lived and worked in Chittenden County for the past 44 years. Our son, Alan Gottesman, died by suicide 6 years ago at the age of 25. The main point I'd like to make today is that for a person experiencing suicidality, access to health and mental health care, though important, is not enough. Clinicians who are responding to these patients need to know how to both evaluate and provide skilled treatments. Alan was a sweet, gentle soul and a talented jazz musician. He was a good man who, like most people who die by suicide, felt trapped in a whirlwind of loss and pain that he thought would never end. What we learned after he died, when we reviewed his medical records, was that although his providers thought they were providing appropriate care, their actions showed that they were not. What I've also learned since Alan's death is that in the last 10 years or so, a few very good treatments, psychotherapeutic treatments that specifically target suicidality, have been developed and proven effective nationally, but most clinicians practicing in our communities don't know about these effective approaches. There are some exceptions. For example, thanks to leaders like Alison Crump in the Vermont Department of Mental Health and those in the Vermont Suicide Prevention Center, clinicians in about half of our designated mental health agencies have been trained in these effective approaches. Also, about 200 of our 1,500 independently licensed mental health providers have received training in suicide care through the Vermont program for quality in healthcare. But we are not even close to having a system of health and mental health care in which providers in every county in Vermont have even rudimentary training in evidence-based approaches to suicide care. There is much work to be done so that suicidal people don't fall through the gaps in our care system as our son did. The funding that is now being requested by our suicide prevention leaders is sorely needed and long overdue.